about um, some more about sexuality and aging. Uh, just a few things to brush over. Nothing as involved as the first lecture. So you get older, changes are going to occur. They're called transitions, of course, life transitions. Um, and it even involves the definition of actually what you want to identify sexuality as an older person. What does sexuality and intimacy mean to you now that you're older? Some older adults want sexual and intimate relationships. Others want one or the other. Some don't want any at all, and there are a lot of reasons for that. So there are things that happen to you as you get older that have a major effect on how you handle the sexuality business. Your emotional state, your physical state. Um, how do you feel about physical activity? Maybe you're incapable because of some physical problem. Um, and the satisfaction related to having relations with someone uh, may not even be in your desire repertoire. Um, some old people think it's better. They don't have to worry about time so much and privacy because they may be home alone with one another. There's no worries about unwanted pregnancy. There are fewer distractions. Sometimes they can have more intimate encounters. Uh, Even though they're older, they can have more intimate encounters, depending on, of course, the who's involved in this. Now, physical changes. What does that involve? Well, your body changes, your weight changes, skin gets thinner, you lose muscle tone. Some people don't feel good about getting old. They may worry that their partner, their wife, husband, whoever it is, may not find them attractive anymore. And then health conditions that can cause um, problems, physical problems, stress and worry about things. Yeah, old people stress and worry too. So these things can cause problems with sexual activity in older people. Two common things that happen to older people: physical changes in the equipment that you own, use your imagination, and then dysfunction of that part of your. Excuse me, I'm sorry. I got to move something. My bad. Um, Changes in the physical items used for this, if that's okay with you. I don't want to get graphic right now. I'm not ashamed of it. Just don't want to get graphic. So, what are some of the other problems besides that? Well, kind of have a combination. Alcohol, maybe too much alcohol. I know people that after all the kids are gone, moved out, they've begun to enjoy too much of that. Arthritis, chronic pain, some cognitive things such as dementia, depression, diabetes, heart disease, incontinence, medications, obesity, stroke, surgery, a lot of things, in other words, that are um, that are really out of your control mostly. Now, one more thing, and this is an all over the place kind of discussion, so I apologize, but these things are just items that don't often get addressed. And here's one that's never talked about, believe it or not. Age. If you think older people can't have multiple partners, think again. Um, I have a son who works in an old folk home and out in Arizona, and he said that's an active place. Marijuana is legal out there, and he said you walk by the gathering place out on the patio. He said, "Yeah, you smell a lot of marijuana." They had a lady get kicked out of the thing. She's 86 years old, got kicked out of the home for smoking marijuana in her room. Not supposed to smoke anything inside the building. So they're active as much as they can be active. But they also suffer some of the consequences. So if you're sexually active, guess what? You have the potential for STD. You have the potential for contracting AIDS. There are a lot of things that are out there that you may come in contact with, whether you're young or old. But the point here is even old people have the same concerns as in that regard as younger people do. So the thing to do with this is to do the same things you would have done as a younger person in terms of these things. As far as being an old person and what can I do about the physical changes and so on and so forth, there are medications for some physical things. You just have to take your situation and do with it as you see the ability come before you, meaning nothing more than, can I do this? Simple as pie. So I know it's kind of off the wall, but it's not something that you often hear people talk about. And this is a human sexuality class, and we talk pretty much about everything. Not all of it, but pretty much. So there you go, kind of a weird little lecture, but I hope you enjoy it. And I'll be seeing you soon.